Let me go, first of all, to the situation at Red Hill, which was our own basically toxic exposure events. And I think, Secretary Elma Hall, you are familiar with what happened there. As we talk about loss of data, et cetera, and the need to coordinate between DOD and VA, these are thousands and thousands of people who were exposed to jet fuel leaks at Red Hill. And it occurs to us that there should be a way for some kind of tracking and tracing of the health issues attendant to this exposure while they're currently in active service, as well as presumably they're going to become veterans. So is this something that you all are already doing something with the DOD to make sure that all these people who experience this exposure are not lost? So I think, Ms. Theriot, you also talked about the need to coordinate records, health records with DOD. So can you just talk a little bit about how you expect to keep track of all these people? 94,000 people at least who were exposed to the Red Hill situation?
Yes, Senator. First of all, I enjoyed visiting Hawaii for the NASDAVA convention and had a chance to spend time with Dr. Anderson and his team at the Pacific Islands healthcare system. I am aware of this, certainly, and Dr. Hastings can help us summarize the exciting work that the Interagency Research Working Group is going to do specifically on investigating jet fuel exposures and conditions that may result from that. Dr. Hastings?
Absolutely, sir. Senator, Red Hill is one of the cohorts that we are concerned with. We're concerned with many, and we do follow them. There is a registry of those people that were exposed that DOD has. We meet monthly with the Deployment Health Working Group, and though it says Deployment Health, we also cover garrison exposures. Those exposures at Red Hill would fit into that. And this is a cohort that we will follow into the future. And this will be decades of following it, but that is what my office does routinely. We follow cohorts, we look at the health outcomes, we look at how to care for those veterans and their families. This is not exactly a Camp Lejeune scenario, but we're going to look at it in the same manner.
That's good, because I think that there will be some long-term health issues, and that there is a provision in the PACT Act that directs the department to study the impacts of jet fuel exposure. So I assume that you are doing that, and I would welcome information on how that is going.
Absolutely. The Office of Health Outcomes Military Exposures started looking at fuels and jet fuels exposures about 2 years ago. We have already completed some of that preliminary work, and thank you very much for the PACT Act that expands that and allows us to work with the National Academy. We are very excited by this work. It is important. It is jet fuels, are what the military runs on, and we have to know more about them, and we are doing that.
Definitely, because I hear from individuals and families who had all kinds of health issues that clearly needs to be tracked. And so we don't want to end up a situation that resulted in our having to pass the PACT Act, where exposures going back decades had to be somehow, we had to figure out the cause and effect. So what you're doing right now is very important. I also want to mention that the vacancy rate at VAPEX, which is the VA healthcare system that covers Hawaii and the Greater Pacific, has been at about 19%, and we've made various efforts through this committee and more recently through the PACT Act to provide a lot more flexibility to the VA to hire people. And I'm just wondering whether there are unique circumstances in Hawaii that makes it that much harder to hire and retain people. So have you given some thought to, it is not a one-size-fits-all situation, that Hawaii poses maybe very unique challenges to get this 19% vacancy rate down? You look as though you're wanting to say something, Mr. Secretary.
Yes, Senator. I had this conversation with Dr. Anderson and his team, who did mention that the healthcare labor market is particularly difficult, and as you mentioned, that's borne out in the data. Ms. Therrett summarized all of the exciting new authorities that will allow us to pay people much more competitively, but also to retain them with the
Yes.
ability for larger retention bonuses. Again, thanks to you and this committee, we now have that. I also had a conversation about how we could work better with the Tripler Army-based staff and allow even more services to be shared with them, and had a chance to come back and address that with the Health Executive Committee and DOD. And if we have time, Mr. Kiyakawa can talk about some of the other exciting work we're doing with DOD.
Well, my main question is, I think that there are some very unique circumstances that in Hawaii that we have to get creative in how you all are going to take care of all the veterans, especially as we are expanding the number of people who will come for VA care, including specialized care for women veterans, and there are a whole ranges of different kinds of care, and really we need to get this vacancy rate down. Thank you, Mr. Chairman.
Senator Moran.